Presentation of Dialogue on Idaho Public Television is made possible through the generous support of the Laura Moore Cunningham Foundation, committed to fulfilling the Moore family's legacy of building the great state of Idaho.
Congress is wrestling with the most serious attempt at major health care reform in more than a decade. Public options, employer mandates, what exactly is on the table? Find out and call in with your questions. Dialogue is next. Hello, I'm Joan Cartan-Hansen. Thank you for joining us here on Idaho Public Television, on the World Wide Web, and on public radio stations. Healthcare reform will dominate Congress's agenda this summer. There are currently at least 10 different proposals on the table. So why the push now? Well, before the recession started, 2/3 of all adults in America were uninsured, underinsured, or had trouble paying for or even obtaining adequate health care. In Idaho, nearly 1 out of 3 people under the age of 65 had no insurance at all. And of those uninsured Idahoans, nearly 85% are employed. Healthcare reform was one of the hottest topics in the last campaign, and proponents say they will have some kind of bill this summer. So what is Congress considering? What ideas are on the table and what are off the table? And what could it all mean for you? Joining me now to discuss some of the major elements of healthcare reform and to answer some of your questions are Dr. Robert Vestal, co-chair of the steering committee for the group Idaho Healthcare for All. Doctor, thank you for joining us. I appreciate it.
Thank you, Joan. It's a pleasure to be here.
And joining us in our Moscow studio is Professor Brian McQuaid, Assistant Professor of Political Science from the University of Idaho. Sir, thank you for joining us there in Moscow.
Yep, pleasure to be here.
And of course, we want you to join the conversation too. Give us a call, toll free at 1-800-973-9800. Now, of course, I have a couple things I have to warn viewers about. We've had some technical issues this evening, so you may notice some pops out of our microwave out of Moscow, so just be aware of that. And we also had one of our guests who could not make it tonight, Dr. Ted Epperly, was scheduled to appear, but he, of course, was called back to Washington, D.C. to actually testify on health care reform. He sends his regrets that he cannot be with us tonight. I also want to warn viewers it's a very complicated topic we're jumping into tonight, and this won't be the only show that we'll do. So we couldn't get everybody here at the table, but we're going to try and take on this topic for you as it develops. So let's get started and dive in. There are 4 basic elements among those 10 different proposals, and I want to try and touch on those. The first one being is, should everyone be required to have health care insurance? That's one of the proposals you find in almost all of the proposals that Congress is considering. Doctor, let's ask about it. Is that what we should do? Is this how we should handle healthcare reform?
I think it's essential that everyone in our country participate in some kind of health coverage program. And the reason for that is that we cannot continue to subsidize the care of individuals who don't have any coverage at all by higher premium rates, by variations in hospital costs, and so forth. And so ideally what we would do is expand the risk pool to the entire nation.
Professor, what do you think? Should health care, do you think it's politically viable to get a plan through that would require health care insurance, everyone have it?
Well, this is one of those issues that's going to invite all kinds of interest groups lobbying on this. If people remember back in 1993 when President Clinton proposed his massive healthcare overhaul at that time, one of the contentions was over whether employers should be mandated to provide the coverage. And as people probably remember the Harry and Louise ads in the insurance industry's opposition to employer mandates, especially small businesses opposing employer mandate. This time we're in a completely different situation. And what you're going to see is a lot of fighting from small business. The U.S. Chambers of Commerce just came out against the employer mandate. But the political environment has changed this time. The political environment is now recognized that there's a problem. And so we're going to be in a situation now where the fight is going to be over how do we get there. Do we require individuals to carry insurance? Do we have employer mandate, or do we encourage cooperatives of some kind? This is the way to eliminate adverse selection, where you only end up with insurance of the sick, and the healthy don't opt for insurance.
Well, let me ask you a little bit about the insurance industry has, and the pharmaceutical industries, the players in this, the special interests, are starting to invest incredible amounts of money in lobbying on this particular issue. Is that going to make a tremendous difference, or has this train kind of already left the station? Is healthcare reform going to go?
Question.
I'm sorry?
I didn't hear the question
I
because
apologize
of the technology
because of the technical.
here.
Yeah, I apologize. I was saying the special interests have proposed and are spending large amounts of money on this issue, trying to stop much of the healthcare reform. Do you anticipate that that's going to have a major impact this time around, or has the train already left the station? Are we all healthcare reform already going to go?
Well, this time, what you're going to see is a large different configuration of interest fighting, and there's going to be a lot of money spent. Well, we haven't seen as much of this yet because right now the other players want a seat at the table. All the players want to be part of some package. They all know something's going to go through, and so they're trying to get a seat at the table. What you're going to see in the next few weeks as this proposal comes out in the Senate Finance Committee, and as we see some more concrete actual provision being written into the bill, you're going to start to see the fight start. Okay. Already, Healthcare for America Now has already started running ads here in Idaho. People have probably already noticed those ads. And so the funding, the money is already starting to be spent. The question is going to be in the next few weeks, as we see a real proposal emerge out of the Senate Finance Committee, what's going to happen after that.
Well, let me toss it back to you, Doctor. Do you see this as a foregone conclusion that we're going to get this health care bill out, whatever it is?
You know, I'm not as convinced that we're going to see legislation this year. In my mind, looking at the proposals, looking at the controversy, and the challenges that the nation faces in terms of trying to solve the health care reform problem, I wouldn't be surprised if we end up with pushing this legislation into the next session and possibly see some more negotiation.
Though the reason why they want to do it now is it's not an election year.
Well,
you push it into next year, it's an election year.
That's a good point. And I think that there are a lot of Americans who want to see real reform. And what we're seeing so far, I would characterize as incremental change.
Let's talk a little bit about that public option. That's one of the other elements that seems to be following, although there's a lot of variations on what that public option may be. First, could you define what a public option is?
My understanding of the public option as it's been proposed is that it essentially attempts to provide access to health insurance coverage by one or another mechanism, either at a national level or at a state level, through a gateway or a health insurance exchange mechanism, to individuals who are otherwise do not have access, either through an employer-sponsored program or some other means.
So essentially, the government potentially setting up a healthcare insurance company, essentially, or running a co-op or a nonprofit or something that's where if you were not getting your insurance from your employer's plan, you would go to this plan.
That's right.
I know there's also been some discussions about a nonprofit co-op running this particular public option as opposed to the federal government itself.
Well, many individuals would probably prefer that. To keep health insurance, health care entirely in the so-called free market economy. I'm not convinced that that's the best way to go, but it certainly is what's on the table right now. It's getting the most attention, and we'll see how the programs are ultimately defined. The three leading, most discussed proposals now on the table, that in the Senate Finance Committee, the Senator Edward Kennedy's committee, the Health, Education, and I think, and Pension Committee.
Yeah, the
Is
Health
that it?
Committee, I like that.
The Help Committee, Labor and Pension
Yeah.
Committee, and also the Tri-Committee in the House, essentially are proposing a health exchange kind of cooperative where insurance would be available, not necessarily, as I understand it, a pure government plan where the government is the insuring agency. Instead, they're trying to make health care insurance available by several vendors, many probably, in these cooperatives.
Does it all come down to having a big enough pool to carry the risk?
Well, you know, that's what makes, that's one of the things that makes the single payer option, which is not getting much attention, very attractive, in that it would expand the risk pool ideally to the entire
Everybody.
nation, to
Right.
everyone. And the major problem, as I see it, in our current healthcare system is that the insurance industry has stratified the risk pool into low risk, medium risk, high risk. There's been an effort to, you know, frankly, preserve the bottom line rather than take care of the people who are covered.
Okay, let's get to our first phone caller. Philomena in Boise.
Hello.
Hi there. Go
Yes,
ahead.
I'm a nurse and I work here in Boise, and I was trained in the socialized medicine era in Ireland, and it's pretty much the same as what it is in Canada and Australia and New Zealand and England, and I wouldn't recommend it to my dog.
Oh dear.
I just think it's a rotten system. It started out with wonderful intentions, but it really is not a good, so I don't know what the answer is really, but I know socialized medicine is not where it's at.
Okay, thank you for your call.
Okay.
Joan, let me say that I don't think any of the proposals in Congress right now could be classified as socialized medicine. The British healthcare system is socialized medicine. I'm not familiar with the system in Ireland. I would dispute the notion that the Canadian system is socialized medicine. It is rather social insurance, because in Canada, the government and the provinces, through taxation, basically, provide the mechanism for reimbursement. But the physicians and the hospitals are not employees of the province or the Canadian government.
Okay.
And that's what socialized medicine would be.
You're actually an employee of the
Exactly.
program.
The
But
VA
none of the plans that are on the table
None.
now take America anywhere near that.
No, and you know, an example in our own country of socialized medicine is the VA healthcare system,
Right.
which actually functions rather well. The data show that quality of care in the VA exceeds measures of quality of care in the private sector by a small percentage.
Let's go back to that idea that employers are going to be required to provide insurance. Professor, how tenable is that? What kind of political ramifications will that have?
Well, it's not likely to go through politically. It's not supported because it violates sort of the free market principles of the country. Big business will oppose it because they're already burdened by the extremely high cost of healthcare. And so I see it's more likely that these insurance cooperatives are going to get more support, because then employers can sort of shop for the best deals from different cooperatives and to reduce their cost. Employer mandates are very tricky because employers are already shedding millions of jobs in this economy, and adding another burden is likely going to have political repercussions for both Democrats and Republicans facing re-election next year. So I don't see the employer mandates as getting very much traction. I see the cooperatives as getting more traction, and the individual mandate that everyone must have insurance of some kind whether through if they're happy with their current employer-provided coverage, they can keep that. If they have their own individual insurance, that's fine, or if they want to go with a government-sponsored cooperative, that's fine. But there is going to be a push that everyone has to carry it.
Some kind of, well, and essentially my understanding is under all these plans, the government will subsidize those people who are too poor currently to get insurance, because they're kind of in the middle. If you're extremely poor, you already are on.
You're going to be on Medicaid.
You're going to be on Medicaid.
And
if you're in that middle batch where you're not employer, those are the ones who
right.
don't have insurance.
And the various pieces of legislation so far on the table propose varying degrees of adjustments in financial eligibility for Medicaid.
200% of poverty level to 500% of poverty level, depending on
yes.
where you're. Is there a certain problem of getting people used to the idea that you absolutely have to have health care insurance? Because there's a number of people who, especially young people, who forego any kind of insurance because they just can't. They think they can't spend $300 or $400 a month, and they can't.
I think that issue is yet to be resolved if it's implemented.
Right.
In Massachusetts, they have mandated health insurance with significant penalties. I believe the penalty to the individual for not having insurance is $1,000. To the employer for not participating or providing health insurance access, it's around $300. Frankly, one of the problems there is that it's more cost effective for the employers not to provide the insurance and pay the fine rather than $5,000 or more per year to cover their employees. So I agree with Professor McKay that this is a real problem, especially for small business.
Has the issue of portability been dealt with, so that if I lose my job, I have an employer-provided insurance, and I lose my job, I'm going to be able to take it with me?
Back in
Yeah, go ahead.
Back in 1996, Congress had tried to deal with the COBRA issue.
Right.
But the problem was what they ended up doing is, let's say you lose your job and you have 60 days with which to sign up for the extension of coverage where you can still be covered. It's going to cost you 4 or 5 times what you were paying in premiums.
All right.
Under your when you were employed.
And that is a real problem. People can't afford their COBRA.
So I think what's going to happen if you lose your job and you have employer-sponsored health insurance, you're going to fall into the category of individuals who would seek coverage, who would have to seek coverage through an exchange or health insurance cooperative.
Okay. Well, let's get to our phone callers. Let's see. Kurt in Emmett. Kurt, go ahead.
Yes, I'd like the panel to address the question of the U.S. Everybody keeps saying that we've got the best healthcare system in the world, but we're behind Canada and Sweden and France as far as healthcare goes, because of, at least from my standpoint.
In terms of life expectancy and other factors.
Right, and they do have socialized medicine in those 3 countries.
Okay.
Well, again, let me emphasize that Canada doesn't have socialized medicine. They have government.
Kind of a hybrid system.
Yeah, it's a hybrid.
Yeah.
They have centralized funding for health insurance, but it's privately delivered.
Right.
And that's what the single-payer proposals are advocating in this country. Okay. This problem of quality of health care is a real concern. We are paying at least 2 times what, say, the Canadians are paying, and yet the quality of care, as measured by things like life expectancy, infant mortality, and so on, are not much different, maybe a little bit worse in some instances. So, I think that just pushes us in the direction of having to do something significant in order to improve the situation in the United States of America.
Okay, let's go to Daniel. Hi, Daniel, where are you calling from? Daniel, are you there? Let's try that again. Daniel, are you there?
Yes,
Hi, where are you calling from?
I'm calling from Harpster, Idaho.
Okay, and what's your question tonight?
Well, I have a question. I believe I heard you say that all these ideas and plans would require mandatory participation by individuals. And I was wondering, does that mean that I'm going to have to pay for that? And if I don't participate, are things like maybe I'll be put in jail or are my children going to be taken away? And also,
I think in this case, as I should remember, these are all proposals on the table. Nothing has been passed into law
yes,
yet.
but they all have that in common.
They all do have that in common.
You know,
I think.
and
Well,
so
I take it
what-
back. There's one. I think there are one or two plans that don't have required insurance, but I think there's only one or two, and they're none of the major plans that are
Right.
currently before.
Both single-payer proposals would simply extend health care to everyone. And
Well, somebody, it would seem to me, is going to have to pay for this.
Well, that's a good. Actually, Daniel, that's a good question, and let me toss it up because how we're going to pay for that is a huge issue. Thank you for your call, Daniel. I appreciate that. Okay, let's take. They are estimating that Senator Kennedy's plan, forgive me, is $1 trillion over 10 years. Let me ask the professor first. Professor, how are we going to pay for this?
Well, that's the huge question right now, and there's several different proposals. One proposal is to tax your employer-provided health care benefits. So if you give $500 a week of equivalent health care benefit, you would be taxed on that. It's never been taxed before. Since the 1950s, when employer-provided coverage began, that's been tax-free. Whatever you pay for health care insurance and what your employer provides, it's tax-free.
Right.
They're talking about taxing that. That's one proposal. Another proposal that's been moving through is to cut the rates in which Medicaid and Medicare pay for doctor-provided coverage, tax, MRI, things like that. They've been making deals in the last 2 weeks to try to cut the cost of those programs so they can turn it over to the healthcare system. They're talking about if we go to the insurance cooperative system that they can reduce the premium cost for that so that everyone will be able to afford the cost. You know, the question about how individuals can pay for it, really you have to think about car insurance. You're required to have car insurance in most states, and if you don't have it, you can be fined or they have some restriction on your license, or you have to show proof of insurance, that sort of thing. We already have a mandated system for car insurance. So policy reformers have been suggesting that we can do the same thing for health care.
Well, Joan, one of the things I'd like to add is that, and I agree completely with Professor McQuaid, in terms of the proposals that are on the table. However, I should add that the three major proposals in the Senate and the
Two in the Senate, one in the
two
House.
two in the Senate and one in the House don't even address financing yet. I think they're trying to figure that out. But let me say that, and some of our viewers may know this, that our overhead costs, the administrative costs in the United States for delivering health care are the highest in the world.
I was surprised at an individual policy, 30 to 40% of the cost.
Well, it's not just the policy,
It's just
Joan.
the overhead. It's overhead.
But that overhead includes not only the cost of doing business through the insurance companies, and that averages about 7%. Some policies it's much higher, as much as even 50%. But the majority of that figure actually resides in doctors' offices and hospitals, where large staffs have to be available to essentially deal with claims and denials and adjudication.
And anyone who's had to go through all that, and we all have, if you have insurance, it's
very
nuts. It drives you crazy.
cumbersome.
Yeah.
And a conservative estimate of what could be saved by eliminating all of that is $400 billion per year, enough probably to cover everybody.
Okay, well, let's go to, let's see, I think Norma was next. Norma in Ontario. Norma, go ahead.
Hi. I'm one of those who was not able to get insurance if I hadn't been employed by the government before. What are you doing for those who cannot in any way get any insurance?
Actually, the plans do address that. Talk to about that.
Yeah, that's a very important question, and many people suffer from this, from denial of coverage. My reading of all of the plans, virtually all of them, especially the leading three, require coverage.
So
And
that
that's certainly
they have to provide
yes.
an affordable policy for people who are at high risk.
Policies have to, something has to be provided, and it's certainly part of the policy that President Obama has discussed.
Gentlemen, I apologize. We're rapidly running out of time, and I know we've barely scratched the surface on all this. I want to give you both a last-minute, 1-minute comment. If people are obviously interested in this topic, where should they go to get more help? What do you recommend, Professor?
Well, at this point, people should be watching the next few weeks. The next few weeks are going to be critical in Congress. We're going to see some kind of proposal coming out. People who are interested in what's happening should watch that, contact their senators, representatives. Keep up with what's going on. Watch the industry. They're going to start running ads on your airwaves. You're going to start to see the debate. You're going to start to see different debates about the different options. The costs are going to be very different for each of us. And so that's something we'll have to watch very carefully.
And Doctor?
Well, for those who really want to look at what's on the table now in Congress, I would recommend that they visit the website for the Kaiser Family Foundation. They lay out the proposals. I used it to help get a grasp of these diverse proposals. The other place I'd recommend going is to the website for Physicians for a National Health Program. That's pnhp.org. They have a lot of interesting information that relates to healthcare in this country and healthcare reform.
Right. And and we do have the link to the Kaiser Family Study on our website, so you can find that information out by going to idahoptv.org and clicking on that. Gentlemen, thank you very much. I appreciate you, Professor, joining us there in Moscow, taking the time and battling through the technology. I appreciate that. Doctor, thank you for joining us here.
Thank you, Joan.
And of course, as I said again, be sure to check out those links on the website. Also look for our Web Extra. We're on Facebook. You can find us there. You can find us by searching Dialogue on Idaho Public Television, and we invite you to become a fan. Thanks for tuning in, and we'll join you here next time for Dialogue.
Presentation of Dialogue on Idaho Public Television is made possible through the generous support of the Laura Moore Cunningham Foundation, committed to fulfilling the Moore family's legacy of building the great state of Idaho. To order a copy of this program from Idaho Public Television, call our toll-free number or visit us on the World Wide Web.